amending budget for healthy families.
This resolution accepts a grant and amends it in the budget in connection with the Healthy Families Program for Herkimer County. May I have a motion? Mr. Smith, his name is. Second, Mr. Shaw. Any discussion? Mrs. Rose.
Mr. Chairman, is this the, just make sure I'm in the right term. Is this the preventing space? This is just the whole grant for healthy families. No, I'll save my comments for another resolution. Thank you.
Any discussion? All those in favor?
Aye.
Any opposed, nay. Resolution passes. 192.
Human Resources, Ways and Means authorizing contract with Family Nurturing Center in connection with healthy families.
This resolution authorizes a contract with Family Nurturing Center to implement the Healthy Families Program. May I have a motion? Mr. Smith, second by Mrs. Manini. Any discussion? All those in favor, aye. Any opposed, nay. Resolution passes. 193.
Human Resources, Ways and Means authorizing extension of lease in connection with healthy families.
This resolution authorizes an extension of lease for program space at 257 North Main Street, Herkimer, for the Healthy Families Program. May I have a motion? Mr. Smith, second. Mr. Hendricks. Discussion. Mrs. Rose.
Mr. Chairman, I know that when we first entered into this lease, at the time I questioned the utilization and could we not find space within our properties that we already own. I still have concern that I believe the space is underutilized, and we should be, if we're going to pay $10,800, whether it's a grant or not, be certain that it is space that is absolutely necessary. I've had observations made to me of the underutilization, and I have asked to see some information and data that supports the utilization, but I've yet to receive that, so I will not be able to support this. Thank you.
Any other discussion? All those in favor, aye. Any opposed, nay.
No.
One nay. Resolution passes. 194.
Human Resources, Ways and Means accepting Health Foundation grant.
This resolution authorizes acceptance of a grant in the amount of $50,000 from the Health Foundation for Western and Central New York for a pregnancy outreach, parental, and parent support program. May I have a motion? Mr. Shaw, I'm sorry, Mr. Hyde, second by Mr. Smith. Wow. Any discussion or debate? Mrs. Rose.
Mr. Chairman, when this was presented to us the other night by Dr. O'Keefe, Dr. O'Keefe first gave us an update on our PCAP program that Herkimer County is no longer rendering to pregnant moms. And Dr. O'Keefe did indicate that the 6 cases that we were carrying were able to reach services in, I believe, in Utica at St. Elizabeth's Hospital or another provider in the city. This particular grant, as it was presented to us, would buy a van, and pregnant moms in the county would have to figure out a way how to get here to the county office building. And then we would be doing some training, and training is important for moms. And then they would be trained riding up in the van, and then they would all go up for their appointment. And the driver of the van would be a worker that's already on board, and this grant would be used to pay half of her salary along with the van. The concern that I have is, first of all, training while you're driving, and that's the person that's going to drive. I don't know that that's always the safest thing to do. And the moms have to get here to the county office building to get into the van to go to Utica. And if they're able to get here, because I don't imagine all the pregnant moms are within close proximity to this building, that we ought to figure out a more creative way to access $50,000 and have a major impact on birth in our county. And I don't think that this is a creative enough approach. I think that it sets in place I think probably by giving up the PCAP program, it wasn't a mandated program, and if there were costs associated to the county. But I think this is a Band-Aid that really isn't going to be doing perhaps what should be done. I know it's a grant, but let's face it, we know grants come from taxpayers' pockets, and I am not going to support this. Another vehicle on the fleet, the insurance, et cetera, et cetera. I think that we should find a better way to do this. Thank you.
Any other debate? All those in favor? Aye.
Roll call.
I'll allow the roll call.
Thank you, sir.
Mano.
Yes.
Smith.
Yes.
Ono.
Yes.
Ackerman.
Yes.
Kaplinski.
Yes.
Horst.
Yes.
Russell.
Yes.
Shaw.
Yes.
Weekly.
Yes.
Hartman.
Yes.
Rose. No. Schrader.
No.
Manine.
Yes.
Johnson.
Yes.
Hendricks.
Yes.
Hyde.
Yes.
Kaczynski.
No.
Resolution passes. 195.
Ways and Means accepting proposal for provision of e-table services.
This resolution authorizes an agreement with e-table services to the Herkimer County Treasurer's Office. May I have a motion? Mr. Russell, second by Mr. Malinsky. Any debate? All those, Mr.
Well, Mr. Chairman, I just want to thank our treasurer, Tim, Nina, and Mr. Wallace, and all those that have worked on this, because this is another area in which the county can hopefully garner some additional revenue. So I appreciate the work. I'm certainly, as for the passage of this, I certainly hope that we'll be able to garner the revenue that we are purchasing. Thank you.
Any more debate? Mr. Hart.
I'm trying to, we're on,
195. It's on the desk.
with the GASB fund balance report? No, never mind, okay. That's what I thought. I apologize.
Okay, any other debate? All those in favor, aye?
Aye.
Opposed, nay. Resolution passes. 196 is a roll call.
Human Resources Committee, Ways and Means, amending Resolution 326 of 2011 for hourly employees.
This resolution amends the part-time hourly salary schedule to include an additional position. May I have a motion? Mr. Hendricks, second by Mr. Smith. Any debate? Mrs. Rose.
This is giving somebody a salary raise, it's not amending, is it another position, or is it giving a raise?
It's adjusting wages.
So we had, this is, I believe, when this came before public safety, when it was discussed, it was looking to give a raise to a part-time employee. None of our part-time employees receive raises. Is that what this is?
Yes.
Okay, so, at the public safety committee meeting, it's a part-time registered professional nurse with a salary rate currently of $18.61 going to $18.98. And, you know, some can say that's not a lot of money, but Mr. Wallace, and I do thank you for the email that you sent to us. We have a host of part-time positions in our county. We have a part-time motor vehicle clerk, we have part-time photocopy machine operators, part-time data collectors, court attendants, building maintenance workers, community health nurse, senior telecommunicator, typist clerks, computer programmers, account clerks, cleaners, principal account clerks, and a variety of other food service workers. None of these people receive wages increases in our contract, and I don't, not our contract, but in our budget, and I don't know why we would take one single position and offer a raise there when all of these positions that Mr. Wallace supplied us in part-time didn't get the raises. And when this was considered in public safety, I don't believe we knew all of these titles, but I do think that I didn't hear a justification on why that particular position should be treated any differently than we did all of the other part-timers.
Budget time's around the corner. I'm sure we'll be talking about it. Mr.
Well,
Russell.
this is a
Mr. Chairman, I certainly respect those that want to support this. And I certainly understand that for a nurse that this wage is low based on my experiences. But personally, because the other folks didn't get, the other part-time people didn't get raises, I would personally like to look at this in September or whenever we're doing our budget meetings to be able to explore how we're going to work on giving all of our part-time people some kind of a raise. That's what the legislature would want to do. One of our colleagues, Mr. Hyde, had a very good point. Everybody is struggling these days, and it certainly worth the actions of not only the committee but of the legislature, you know, to look at all part-time employees and see how we might be able to help or not. So I'm not going to support it for that reason. I like to try to do these things when we can during budget time, and like I said, certainly respect those that want to support it because it's not a huge amount of money for us.
Any more debate? Aye. Mr. Hyde.
I would just like to say that I will support this issue, but I would also like to say that our part-time people, we have a lot of respect for them. They do a good job, and they're not getting paid the increases that everybody else is getting paid. It doesn't make sense. They don't get health insurance, they work fewer hours, and they get less money. And in many cases, I think you would find that some of these are single parents, trying to make a living, getting any part-time work they can because there is no full-time work. And I just hope that the Ways and Means Committee will give this serious consideration at the beginning of the year so these people get the raise they deserve. Thank you.
Mr. Corsi.
Mr. Chairman, two other resolutions here tonight to raise the salary, hire somebody part-time in the treasurer's office for more than this, probably, maybe not with the amount of qualifications an RN would have to have. And also, Mr. Chairman, we hired a psychiatrist, 122, I think, an hour. We have a request that the Ways and Means Committee responded to. We have a request from the sheriff to consider this. Now, there's department heads for all these other part-time employees. If those department heads submit a request, the Ways and Means Committee, and the Ways and Means Committee deliberates and comes up with a recommendation for this legislature, that's what this process is. And it was, I also think that a registered nurse dealing with the riffraff that are in a jail is earning her money at $18.98. Thanks, Mr. Chairman.
I will support this because I know what nurses have to go through to get their degree, and I also like to be respect for the medical profession and what they do on a daily basis, particularly in the jail setting. I do concur fully with Mr. Hyde. I think come September or whatever, we got to look at whether we can take care of the part-timers when we're taking care of everybody else.
Mrs. Rose.
Just because perhaps people haven't had an opportunity to review this, we have another nurse. Again, this is not about the personalities. These are the titles. We have a community health nurse. A CHN is a community health nurse, I believe. Mr. Wallace can confirm that. So there's a nurse within this. To go to what Mr. Corse has said, and I don't know what the hourly wages are on these various positions. But since I've been sitting here, I've heard more than once, and I just goes to what Mr. Russell also said, is that changes in that salary structure generally have been said, hold for the new budget year, and they'll be considered, bring them in at that point in time. This raise is going to be for the new budget year. We're adjusting it. Let's see. We're taking action right now. It's not a raise now, right?
Yes.
Position and increased only in 2012. So we're taking action now for 2012 when it could be done in the budget process when the gentlemen that have spoken want it all to be reviewed and not just lock in, on that one particular thing. Just to the comment that was made about Dr. Menon, and certainly that's quite a bit of compensation. That individual, we have to have a psychiatrist, and that individual was coming on board to cover while the current psychiatrist was on vacation, was the justification that was given to us. This is not implying that the person working in the jail is not earning the money. I just question why we would take one particular position out of these, set it up for 2012, because we're not making it impact. This 1868 is not a raise. That's what the individual is currently getting in 2011, or is that a raise also?
They're currently 1861, looking to go to 1898,
In 2012. So-
effective today.
Oh, this is the we're in 2012, excuse me. Thank you. I lost a year.
Anyone else need?
Well, I mean, it goes to say what Mr. Corse was saying. Frankly, based on what he said, we could get inundated with Ways and Means Committee on our next meeting in regards to all these part-time people wanting raises. And I really don't think that our budget at this point, and I don't know how much it would be, but based on the fact that we aren't garnering some of the revenues that we hoped to in regards to some of the, I think it was the Medicaid issues that DSS, Mrs. Stormer was getting us, some of the money we had to spend in regards to boarding out, whether now, if we're put into that position in our next meeting, Ways and Means, whether we can actually afford it. And I know that we've done a few changes within the last couple months that we thought were very necessary, but you really want a lot of ticked off people. If you say no to these part-time folks, the department has come to us. I think you've opened opened up Pandora's box, frankly. I don't want to be in.
Mr. Hyde?
I personally don't think that these changes should be made mid-year. They should be made at the first of the year when we do our budget. We do not stick to that. None of us do. At every meeting, we have somebody making a request to make changes, this, that, or the other. Do it at the beginning of the year, and after that, you're out of luck. And that's, you don't have to refer this to any other committee. Just live to our own budget.
Well, there are times that we have changed salaries, but reduced other salaries.
Granted, rare.
So the budget, hasn't been changed. I mean, that's my concern is ways and means. And I know, my wife's a nurse. I know that this is not a lot of money for a nurse.
Mr. Hart?
I think as an example of what public debate can do, I believe the arguments or the positions and views that were just expressed changed my opinion on the matter. I think this one position as well as all the rest should come before us during the next budget session, and we should seriously consider taking care of, doing something for some of these people. This is a low rate, but we should wait till the next budget session, and it's retroactive to the beginning of the year as well.
It's all of 2012, right?
They've been taken care of last year. So I concur with Mr. Hyde and some Mr. Russell
Hendricks.
and my other.
I would point out that this position is critical to the operation of the correctional facility, and that without this position, and I don't know what the status would be without approving the rate, but without this position, I'm sure that we'd be looking at $90 a day, boarding out more prisoners. We've run into that issue before. I think one of the counties, we had 21 prisoners in one county, and they had a problem with nurses, and we were told to get them out that day. So it's a critical, very critical position.
Mr. Smith?
I want to point out that this raise is not retro. It starts Monday morning if you pass it back.
Mr. Shaw?
It's really two ways to look at this. And I agree with Mr. Hyde that we ought to do this at budget time, and I think we should start that this year and stick to it. But for 37 cents an hour, you can't retrain a person. So you need to think about the $90 a day compared to the 37 cents an hour. And when I look at economics, I agree with Mr. Hyde and Mr. Russell. But we can't train a person that cheap. So I'm going to support it.
Mr. Russell?
Well, actually, when the $90 an hour came up and the fact that other counties did have to shut down, I wonder if the sheriff, if we could ask the sheriff to talk.
Sheriff?
I mean, it's a very good point
I'll allow
what
it.
Mr. Hendricks said.
Being a RN in the jail is a difficult job. It's not like you're riding around visiting senior citizens, and no disrespect to other RNs or anything else. I'm just trying to point out the fact what our RNs go through on a daily basis over there. If you don't have security, if you don't have a cook, and if you don't have a nurse, you don't have a jail. It's very simple. She wants a raise, she deserves a raise for the atmosphere that they work in over there.
Mrs. Rose?
Just to clarify, she's not the only nurse. We have nurses there. And
Another part-time, Sheriff?
we have full-time, don't we?
I'm sorry.
We do have a full-time nurse, but the full-time nurse, she gets sick. She has children, sometimes her children get sick. She's allowed vacations. She has weekends off. This is a 24/7 operation. Again, it's not like, I'm not sure about Dr. O'Keefe's, but it's not a 9-to-5 operation. It's 24 hours, 7 days a week. When we have an issue with an inmate, we have to take care of that inmate. And you have to have trained, registered nurses to do it. It's very simple.
I appreciate the answer.
Mrs.
The
Rose.
point I wanted to make, Mr. Chairman, is that this is not about hiring a nurse. We have the nurses there. There's no one here suggesting we shouldn't have the nurses and that we would resort to $90 a day. We have the nurses. The question is the the amount of the raise, and it's not a significant amount. I do want to understand, if we modify a salary schedule and create a 2012 rate, does that not mean that's the 2012 rate and anyone in that rate would get retroactive to January? It doesn't say here the effective date is Monday morning. It's saying that we adopted the budget in December of 11 and we're going to create a rate for 2012, not a rate as of Monday. So I'm trying to understand, are we setting ourselves up to be January?
Yeah, this is a particular position, so no one else would be affected. That's the first question. And the second resolve, I think is clear, that the foregoing change shall take effect this date, which it means today.
Any more debate? Mr. Russell?
Well, what are the hours of the nurses that are there?
I can answer. Mr. Robert?
Nurse comes in at 8 in the morning, is usually there before 4 or 5 during the day. Depends on the situation, what day it is. Different things happen different days. If there's any medical emergencies, the other part-time nurse, she gives up weekends, she comes in on weekends. When the nurse is sick, a regular full-time nurse is sick. We've looked at hiring other part-time nurses, other part-time RNs. We've gone through Working Solutions, we've advertised on there. We've got a couple responses. This lady's worked for us for 3 years, about three years now. She comes in on weekends, she comes in on holidays. When we need somebody, you have to have somebody. And Dr. O'Keefe oversees our medical staff and our nurses over there. He's a collaborator for our nurse practitioner. And I don't know if I want to say anything, Doctor.
Well, I frequently receive calls from both nurses, but every weekend and often in the evenings, the nurses will call me. They're scrupulous. They do a wonderful job. Their part-time wage is actually a bit lower than our part-time wage over at Public Health. And just to set the record straight, no longer is the county provide a Cadillac for the public health nurse to drive around in. But I will say that the nurses at the correctional facility work very, very hard and do a very good job.
Any other debate? Mr. Schrader?
I have to say, hearing the dialogue here tonight, you've all made very good points, and I did change my decision. I think I am going to vote yes for it. For the simple reason, as the sheriff said, the chance of us having to board out prisoners. I think that's a very important thing that I don't want that on my shoulders, knowing that I voted not to give her a raise and she chose to find another job someplace else. So I did change my decision.
Mr. Johnson?
I'll support it too. I'd just like to side note with Mr. Hyde. We started at the beginning of the year, starting to take care of all our financial situations.
And no changes.
Mr. Russell?
Well, I think it'd be remiss of me if I didn't vote it now, understanding that we could be incurring more costs by having 4 more hours. I'm going to support it as well. I don't like to, but I also don't want more burden on us in regards to having 4 more people out there to close the facility.
I'd ask that you look into it, Mr. Russell, I'm sure we will during budget time. This will be a critical issue. Mr. Hartman?
Now, this particular nurse is my understanding that has worked this is great for 8.5 months, and we're afraid she's gonna leave us and we're gonna have to board out. I would hate to think she would do that, and hopefully we take care of it next year, but also we have a full-time nurse, and if she were to get sick or a child gets sick, the doctor will be fill in on that day. And I can't, I would, it would be a sad thing if she left over this after working 8.5 months, but.
We could discuss that at the next public safety. It's, I mean, a lot of critical issues here to talk about, but anyone else? He calls the question. Second? Mr. Weekly. All those in favor of calling the question? Roll call and calling the question.
No, sorry, sir.
Okay. No roll call?
No roll call.
Okay. All those in favor of calling the question? Aye. Any opposed? We'll call the question. And All those in favor?
Roll call.
I'm sorry, it's a roll call. Clerk will call the roll.
Mr. Hyde.
Yes.
Brzezinski.
Yes.
Mano.
Yes.
Smith. Bono.
Yes.
Ackerman.
Yes.
Kaplinski.
Yes.
Corse.
Yes.
Russell.
Yes.
Shaw.
Yes.
Weekly.
Yes.
Hartman.
No.
Rose. Schrader.
Yes.
Benine.
Yes.
Johnson.
Yes.
Hendricks.
Yes.
Resolution passes. 197.
Ways and means to implement and comply with Government Accounting Standards Board.
This resolution establishes provisions in connection with the Governmental Accounting Standards Board Statement Number 54. May I have a motion? Mr. Russell? Second. By Mr. Smith. All those, I'm sorry, discussion? And all those in favor? Any opposed? Resolution passes. 198, roll call.
Administration, Veterans Affairs to amend the rules of the legislature.
This resolution amends the rules of the county legislature. May I have a motion?
So moved.
Do you want to make it, Ken? Okay. Mrs. Minnie, second by Mr. Brzezinski. Mr. Johnson. Any discussion? Mr. Brzezinski.
Mr. Chairman, can our attorney or somebody explain to me why there was a shift from Natural Resources Committee to Administration and Veterans Affairs when it's a natural resource? Maybe our attorney can explain Rule 23 to satisfy me is
Mr. Malone.
my question.
I'm sure I understand that
Do you want to rephrase that, Mr. Brzezinski? Can you ask the question again?
Yeah, according to Rule 23C.
Okay.
I'm sorry.
I'm not following you.
Are we looking at the same?
We want to know? I'm just a little lost.
This is Jean Manine's, right? Okay. There was a shift from, I believe it was from Natural Resources Committee, wasn't it, the Natural Resources Committee?
I don't believe it was ever a shift. It's just to clarify Rule 23C. It's always been under Mrs. Manine's committee. It's
What? No, that's not what I said.
I'm sorry. It's always been under Planning and Development Committee. It went through committee. So it's always been there, but it just hasn't been clarified, and this is just clarifying that the Mohawk Valley Water Authority specifically will be looked at under the Planning and Development Committee and not under Natural Resources. And I understand what you're saying, it's a natural resource, but if you read the description of the Planning and Development Committee, it falls under that.
Is there a chance that the Natural Resources Committee could be part of it? In other words, go with both committees, because it is a natural resource.
I would ask Mr. Malone.
That's a decision of the legislature to decide which committee to refer matters to, and that's what you do when you amend your rules. You're making, 17 of you are making that decision on what committee will handle it.
But Rod, by
It's up to all.
looking at this, by looking at this here, okay, wouldn't you believe that it should be in that committee also? I mean,
I have to study that, Mr. Brzezinski.
I would ask that Mr. Malone studies that, and we'll get back to, we can bring it back through Jean's, Mrs. Manine's committee.
Move to table this?
Mr. Chairman, I don't think we can table it. I mean, you can change later and add or whatever. Mr. Hyde.
Is there any harm if it goes to both committees, number one? Number two, do you want a motion that it does go to both committees? I'll make a motion.
I have a motion that it goes to both committees.
Motion to amend this for
To
their.
amend, second by Mr. Hartman. Discussion on the amendment to bring it to both committees. Is it legal, Mr. Malone?
Well, it's
Or is it?
it's legal. It's not been the practice here. The only matters that go to both committees are Ways and Means has jurisdiction over any monetary issue, but each committee, one committee generally handles one matter. I think, maybe there are some duplications, but I'm not aware of them. So it's been the custom that you pick one committee that has jurisdiction over an agency or over a question.
I'm sorry, Mr. Walsh wanted
So
to
you've always
comment.
done. You can do both if you want.
That ship has failed, so.
Mr. Russell.
Well, Mr. Chairman, what has been in the past, county planning and development dealt with those areas that were outside of our county. This is one of those groups that's, outside of Waste management, for an example, solid waste. At Herkimer County thing, county planning has done. I think isn't PNFP.
Can I ask that Mr. Malone read the planning development description?
Yeah, well, that's where I'm going.
Okay.
Here are the matters. This Rule 23, it says the duties assigned to each committee. County Planning and Development Committee, general supervision over matters relating to the Director of Youth Bureau, Director of Employment and Training, maintain liaison with boards and supervisors of Legislature of other counties, with various state and federal agencies. I'll skip some of the.
Well, that was the point I was making with various statements.
To recommend means of improving coordination with the entire county operation and its various departments with each other. Cooperate with all organizations organized and dedicated to helping growth in Herkimer County. In particular, such organization financed in whole or part by Herkimer County. Charge of special programs and projects as designated by the chairman of the legislature. Maintain liaison with the Herkimer Solid Waste Management Authority in all matters involving the province's solid waste. So that's in general what planning and development, those are their responsibilities now.
Could we read natural resources? Natural resources is the one that would be considered.
Yes.
Natural resources is F. General supervision over matters who change office of county director of weights and measures. Liaison with Herkimer County Humane Society and supervise dog control activities. Supervise Herkimer County Sewer District and all its activities. Maintain liaison with Herkimer County Soil and Water District. Maintain liaison with Herkimer County Extension Services. And recommend programs and projects of said service. Work through the Farmland Protection Board, supervising agricultural districting matters. Cooperate and keep the legislature informed about the activities of state and private agencies concerning fish and wildlife management, forest practices, parks and recreation, Adirondack Park agencies, and environmental conservation. Perform the responsibilities of the former Committee on Agriculture and reviewing dog damage claims. Mr. Harmon.
I for one think that it's a natural resource, so natural resource committee should have something to do with it. And that list was just read, there are outside agencies, just like the planning board is added on to some of the natural resources that were naturally belong. As far as it's been our practice, granted I've only been here eight years or 8 months, sometimes it seems like, but it was only an hour or two ago I was asking why HCCC broadcasting has something to do with veterans and administration, because it does, that's what we always did. So a subject for HCCC goes to Education Committee, Ways and Means, which is money, makes sense, and veterans, because we think it might belong there. So that's 3 committees. And a little while ago, we were saying normally it's just one. And I've had other instances. I've asked why it's gone to this committee. There's been 1 or 2 involved, and because that's the way it was done. I don't know. I in support of our amendment, I would add natural resources.
I don't believe we can make the amendment under Rule 10. None of these, I'll read it. None of these rules of order shall be suspended except by unanimous consent. None shall be amended except upon majority vote of all members of the legislature after 1 day's notice, accompanied by a written copy of the proposed amendment or amendments, except that any amendment of Rule 2 of these shall require a vote of 2/3 of the members of the legislature. So
Can I ask for a vote?
I'm asking Mr. Malone to
With 1 day.
Rule 10. Clarify Rule 10.
Makes sense. Unless you suspend your rules. Yeah.
So the amendment, just to clarify, the amendment can't be made, it has to go through the committee process, and we'll deal with it there. Mrs. Rose.
Mr. Chairman, what's not lost on me is that the minority placement on committees, we happen to have a member on natural resources. That's just another reason, not the sole reason, because I do think Hinkley is a natural resource. And I do think that there would certainly be ample time for planning and development to give input, and that natural resources should be seeking that input and working collegiately on it. And I just think it's a natural resource and that it would belong there.
We can talk about it through
Well, if
Mrs.
we
Minnie's
pass this though,
committee.
Mr. Chairman, you moved it, you codified it under planning and development. That's my point.
And it has in the past. We've had other issues with Montauk Water Authority, and it's always gone through planning and development. Mr. Shaw?
I think part of the reason why this, and I agree with John, water is a natural resource. But we're talking about drinking water, where the purification plant is in another county. There's piping that goes to that county and the distribution system after that. Planning and development gets involved when you want to do a new project, put up a new building. The water authority provides the water, the drinking water to that facility. And I think that's the gesture why planning and development is more suitable to this than natural resource. Even though I don't disagree with Carrie, water is a natural resource, I'm not gonna argue about that. Due to the fact that that purification system is not in Herkimer County, it's really a tight thing to monitor.
Anyone else? Any more debate? Mr. Russell?
Well, Mr. Chairman, I think this could be, obviously it can't be changed now, but it probably could be changed in terms of all manners considering Mohawk Valley Water Authority, because I think that's the biggest issue in dealing with the water authority. So I can see room for both, but I think the water authority in and of itself should be under planning and development.
Anyone else? Roll call. Ms. Lulon?
Mr. Hartman.
No.
Rose. No. Schrader.
No.
Manine.
Yes.
Johnson.
Yes.
Hendricks.
Yes.
Hyde.
Yes.
Krasinski.
No.
Mano.
Yes.
Smith.
Yes.
Bono.
Yes.
Ackerman.
Yes.
Kaplinski.
Yes.
Corse.
Yes.
Russell.
Yes.
Shaw.
Yes.
Weekly.
Yes.
Resolution passes. Last one, 199.
This is Ways and Means amending Resolution 167, which approved the standard workday retirement report.
This resolution amends resolution number 167, approving the standard workday and retirement reporting for elected and appointed officials. May I have a motion? Mr. Russell, second by Mr. Hartman.
No,
Second by Mr. Ackerman. Any debate? Mr. Hartman.
I will again say what I said when it came to other attorneys that work here, and we were seeing that attorneys that have 7-hour work that week, and so that's anything I'm
Mrs. Rose.
Ditto. I think that we have established as elected and appointed officials a standard work week of 6 hours for many of our elected officials. Our appointed officials in many of the positions in this building are 7 hours, and I don't understand why our attorneys, with respect to the positions that they do, why they're treated in a different fashion. We have on this particular resolution 20 hours, 20 days in a typical month is full-time. We have 2 positions on here that are definitely doing more than full-time work. Divided by the 7 hours to see how many days they're working. It has not been explained to me why those individuals only are required to get full-time retirement credit by working a 6-hour day. It does cost. It does cost us, and it hasn't been explained on why that would be the case, so I'm not going to support it either. I do want to add, I have foiled this information. I thank the county attorney's office, and I'll be making the point that this is aligned with the committee review the law. So thank you.
Any more debate? All those in favor? Aye. Any opposed?
No.
2 no? I have roll call. Okay, roll call. Ms. Lulon.
Mr. Hendricks.
Yes.
Hyde.
Yes.
Krasinski.
Yes.
Mano.
Yes.
Smith.
Yes.
Bono.
Yes.
Ackerman.
Yes.
Kaplinski.
Yes.
Corse.
Yes.
Russell.
Yes.
Shaw.
Yes.
Weekly.
Yes.
Hartman. Rose. Schrader.
Yes.
Manine.
Yes.
Johnson.
Yes.
Resolution passes. Now go to comments by legislators. Any legislator, Mr. Russell?
Mr. Chairman, we had somebody speak in front of us. It's wrong. He said that of us don't dislike the tapings. Now, I haven't heard that from many of us. And I just don't like the generalization that many of us don't like the tapings. And you said there was claims that there was concerns about heading them. I haven't heard those claims either. So generalizations, frankly, I don't care for. I personally like the tapings. And I'm glad that other people have stepped up to the plate to do it, because obviously if they have it right now, then we wouldn't be having it. I just want to reiterate, from this group here, I have not heard people say they dislike the tapings. And it's been inferred that the legislature do dislike it. I think that's an incorrect statement, based on my personal experience.
Any other legislator? Mr. Hartman?
I just like to point out my recollection is different. I've heard that numerous times, and I think it's on tape.
Mrs. Rose?
Mr. Chairman, tonight we discussed the Mohawk Valley Water Authority, and we had a presentation by Assemblyman Butler, and there was a conversation about having a meeting, and I just wanted you to bring us up to speed on when you're going to be meeting, and if there's any update on it, because I know it's a hot button issue.
Yes, we'll be meeting tomorrow.
Who will be meeting?
Myself, Mr. Shaw, and Mr. Koplinski, and Mr. Wallace.
And meeting with whom?
With Mr. Besher from the Water Authority. We've met with the DEC. We're going to have a subsequent meeting with them. And we'll, when I get all the ducks in a row, we'll present it to the committee, and everybody will be part of everything.
I have another issue.
Go ahead.
I sent an email a while back, and I apologize if there's been an answer. I searched tonight and could not find it. As I was reviewing Country Manor, and I was searching out some records, and I put in an email, I believe, to everybody here, a resolution that had been adopted by this legislature when the census population approved for Country Manor was reduced to 40. And I came across that resolution, and in that resolution, it indicated that we would be notifying the New York State Health Department that we were reducing it to 40. It was a directive within the resolution that the Commissioner of Social Services was to do that and amend it, and I guess in essence, our license. And yet we've been having conversation after conversation about the 80 capacity. We talked about turning, asking that the 80 beds be turned into something else. And what bothered me, I asked, did we write to the Department of Health reducing it to 40 as the resolution stipulated would happen? I didn't get an answer, but the fact that we've been I don't believe I got an answer. The fact that we've been talking about an 80-bed facility, are we errant? Do we have an 80-bed facility if the license is modified? If the license wasn't modified, then my concern is how do we have a resolution that says such and such will happen, and then we don't know whether it did or it didn't. And it's more of a general question. The resolutions we adopt tonight, can we assume that what's in them is happening and somebody will come back and tell us if there has to be a modification because it didn't happen? I'm concerned that I didn't hear back on that. And that specific case, I hope that maybe you can direct Mr. Wallace to look into it. And if you sent me a reply on that, I apologize, but I've not been able to locate it. And then I want to know that this is, what we adopt tonight becomes the official instruction and rule, and that it is safe to assume that whatever is in there, this is a question, has been enacted.
We'll look into it.
I should expect, though, that if we've adopted it, it's happening. In general.
Yes, correct.
Okay, thank you.
The way we work. Anyone else? Motion to adjourn, Mr. Shaw.
For our next session, they're going to be having the Central New York Ag Show. I think we're going to use
What kind of farmer are you? All right, Central New York Farm and Ag Show is going to be underway soon, so if you get a chance to go over there, it's a great event, really. It's more interesting than you might think. Anyone else? Herkimer County Fair time also, so don't forget that this week. Mr. Mann.
There's no further business. I move we adjourn to Wednesday, September 12th at 7:30 p.m. At 7 p.m., public hearing on Agricultural District Number 6. And at 7:15 p.m., public hearing on introduction to local law number 3.
Second. Mr. Hyde. Adjourned.
September 12th is Thursday.